How have cystic fibrosis genetic tests rapidly evolved? Imagine how for cystic fibrosis testing has come over the past few decades. It started with simple biochemical tests and now uses advanced DNA analysis to identify nearly all disease-causing mutations. This progress has transformed how we diagnose and manage cystic fibrosis, making early detection and personalized care possible. Back in the 1990s, doctors mainly relied on clinical signs and biochemical tests like measuring immunoreactive trypsinogen levels in newborns. These tests could suggest cystic fibrosis but were not very specific, meaning some babies might get false alarms. Because there was no cure at the time, early screening was met with some skepticism, but research showed that catching the disease early could improve nutrition and health outcomes. The real breakthrough came in 1989 when scientists discovered the cystic fibrosis transmembrane conductance regulator gene, or CFTR. This gene produces a protein that controls chloride channels in cells. When the gene is faulty, it causes the symptoms of cystic fibrosis. The most common mutation, called F508del, was identified early on, which led to the development of targeted genetic tests. These tests could detect specific mutations in the CFTR gene, making diagnosis much more accurate. Combining biochemical tests like immunoreactive trypsinogen with DNA analysis, 4 common CFTR mutations greatly improved screening. This approach reduced false positives and allowed for earlier diagnosis, sometimes even before symptoms appeared. As molecular genetics advanced, especially with the advent of next-generation sequencing, we can now detect over 99% of known CFTR mutations. This means we can identify carriers, provide better genetic counseling, and plan family options more effectively. Today's tests are so comprehensive that they are used routinely in newborn screening programs worldwide. They include DNA testing, alongside traditional biochemical markers, ensuring that most cases are caught early. This evolution from basic biochemical assays to sophisticated DNA analysis reflects a broader shift in medicine toward precision diagnostics based on genetic information. This rapid development in cystic fibrosis genetic testing has made a huge difference. It allows for earlier intervention, tailored treatments, and better understanding of how the disease varies from person to person. It's a perfect example of how scientific discovery and technological progress can improve lives. Always remember, if you or your family are affected, consulting healthcare professionals is essential for personalized advice and care.